I'm Alexandros Tselepis from Greece. I was a member of the reviewing committee for these guidelines, and I would like first to congratulate all authors of these guidelines. It is an excellent text, very helpful for clinicians, elegant and well-constructed tables, very useful also for clinicians. I think that these guidelines are by far the best guidelines on dyslipidemias, and they introduce new targets on LDL cholesterol. We know very well, and we have now the tools that reducing as much as we can LDL cholesterol levels, we can reduce cardiovascular risk in efficiently and safely way. This is the most important in these guidelines. Also, it is very important that these guidelines establish Lp(a) as a risk factor, and we should find the way to reduce Lp(a), and clinical trials are ongoing for this. Also, the use of polyunsaturated fatty acids in patients with high triglyceride levels is very important, and clinicians should also take care of this. So I will not go into details on the guidelines because details have been extensively reported during this Congress. I would like just to also comment about the newsletter released by the European Atherosclerosis Society. It is an excellent newsletter, and I think that all countries, including my country, should reproduce this newsletter into their language as a first step to disseminate the new guidelines to the local practitioners, to the local doctors. This is very important. Concerning Greece, what we are planning to do? First of all, as I already told you, we will produce a newsletter with the most important topics of these new guidelines. Secondly, we will upload on our website all information about the new dyslipidemia guidelines. Thirdly, we will have roundtables during our national congresses. Starting from the national congress, we will have end of this November, of the coming November, where we will have a roundtable about the new guidelines. In addition, we will have a summer school, and in this summer school, we will have extensive discussion on the new dyslipidemia guidelines. Also, I would like to inform people that we will have the Cardiology Society, National Cardiology Society meeting this October, and we have organized already a roundtable about the new guidelines in order to inform cardiologists and all participants on how to implement these guidelines in order to bestly treat their patients in the most efficient way, and, as I told, a safe way. So I would like again to congratulate the authors, and I'm sure that these guidelines will help doctors to reduce the cardiovascular risk by treating lipids in their patients.